Well, for this Pride Month, we want to bring attention to the multiple levels of stigma experienced by LGBTQ plus individuals and its impact on their mental health. To discuss, here's Dr. Stephen Coates, lead psychologist at the Harris Center. Thank you so much for coming here and enlightening us on this issue, because it is quite challenging. I have a nephew that is in the LGBTQ plus community, and he himself has been bullied because of it. So let's talk about first how Pride Month gives us the opportunity to address the stigmas and help us promote mental health in this community.
Thank you for having me, first of all. It's a very good question. You know, about roughly 5 to 8% of the persons in the United States identify as gay, lesbian, bisexual. There's a much larger group beyond that, and we tend to refer to it as the LGBTQ plus community. And of course, with Pride, it gives all of us an opportunity to step back and reflect on people that may be in our families, our coworkers, in our schools, in the places where we frequent for business, who might be in that group or community of people. And we can take this time during Pride Month to try to get to know them and try to understand their needs and help them access services in our community, whether that be for mental health or any other service.
So I talked a little bit about my nephew being bullied. Are there other challenges that anyone in the LGBT plus community face on a daily basis, and how can we as a community support them overcome those challenges?
So you mentioned your nephew, and I'm not sure what age your nephew is, but our youth that are part of this LGBTQ plus community are of particular concern. About 40% of those youth will seriously consider suicide at some point in their development. And they also have a greater risk of actually attempting suicide than their heterosexual peers. So it's a very serious concern, especially when we look at our youth. And we want to be thinking about how we can support those youth as well as the adults in the community. One of the best ways we can do that is through our own family support, our coworkers, our friends, taking time to speak and visit with those people. Ask them, what is it like for you? Is there anything I can do to help you feel more accepted, more appreciated in your community?
More kindness and more empathy.
And absolutely,
yeah.
Empathy, taking the time to think about what it's like to be in someone else's shoes.
So for us, he has a family, but some people, they don't have anybody. In fact, they're maybe even ostracized by their family. Where can they go? Who can they talk to if they need support?
So I will want to take this opportunity to specifically mention a service known as the 988 Suicide and Crisis Hotline. It's a national hotline. You can simply dial 988. You'll be given some options. And of those options, if you are part of the LGBTQ plus community or you identify, there's a specific option you can select, and you can be put in touch with a trained counselor who can be much more sensitive and aware of some of the needs that this community has. And that is a free service provided to anyone. You can also look to your employee assistance programs. Go speak to your primary care physician. Bring concerns up to that person. School counselors. Find a friend. You know, it may not be in your immediate family if you face that rejection. Reach out to someone and try to share your experience. And on the other end, we want to listen to that. We want to listen to their concerns, not be judgmental in any way, and accept them for who they are and where they are in their journey.
And we just have a few more seconds left, but can you tell me a little bit about the Harris Center app for more information?
Yes, you can download that app, of course, on any cell phone. That app will help give you our contact information, our clinic locations. We have walk-in services available at the Harris Center, or you can schedule services.
Oh, that's wonderful. And we know we threw a lot of information at you here, but go on over to our website, cw39.com, where you can access all of that information.